Thank you guys for joining in. We are live once again on Yonkers Voice, and today we have an important topic to talk about. A topic, an issue that can affect anybody regardless of the size of your bank account, regardless of who you follow, who you support. Politics play no part in this, affects anybody. It doesn't care.
No, it doesn't.
It's one of those things that does not discriminate.
No, certainly doesn't.
It doesn't matter. But we need to do more about this subject than just sit and talk about it or get together and take pictures. We need actions. We need results. We need to address the problem. We have Mr. Michael Orth, the Commissioner of Mental Health Department in Westchester County, and Legislator James Nolan. We're going to talk about it. We're going to give you options. We're going to hopefully bring some information that you might not have. Thank you. Thank you for taking the time, and thank you for making yourself available. Perhaps, sir, you want to introduce yourself so they know from you who you are.
Sure. First of all, thank you for having me, and thank you, Legislator Nolan, for your leadership and support in this area. My name is Michael Orth. I have the privilege of serving as Commissioner of Westchester County Department of Community Mental Health, and we're basically a branch of county government that has responsibility for the mental health, the substance misuse and developmental disability system for our county. And that includes prevention, early intervention, treatment, recovery, and making sure that all of our residents really have an opportunity to support their mental health and mental well-being. So we work closely with hospitals, with schools, with cities like Yonkers to really ensure that every person gets the services they need in Westchester County.
Legislator, you want to... They know you, but...
Yeah, you know.
But still.
I'm Legislator James Nolan from District 15, Yonkers, Bronxville, and Eastchester. I felt it was very important, and once Rue reached out to me to ask if we could do this, I said of course, but you know, as an elected official, I only know so much. I wanted to bring the person that is spearheading the entire department for Westchester County and all over New York State, actually. The commission has done a wonderful job and has created a lot of good programs and resources to help this topic, and I'm happy to be here today.
Sir, before we go much further, I just want to apologize in case if you see me here on my phone. I'm not ignoring you. I'm not ignoring you.
Not texting my mother?
No. I can tell. I'm just multitasking. Okay? People are engaging, asking questions, so I'm monitoring it at the same time. The reason I called you, Legislator, the other day was because I had been at the scene, I think, a day or two before, where a man poured gas or other substance on himself and set himself on fire. While I was there, I could hear the family, one sister telling the other sister, I told you that he should not have been released. I don't know released from where, hospital, mental institution, I have no idea. But what we do know is yes, he was released. Sisters were afraid because he could have killed them all in that house. We don't know what he used, but they were afraid. We need to take actions. The system, to me, it's broken in a way. We all talk about programs, we talk about the hospitals that address the issue. The fact of the matter is, you bring somebody to a hospital here in Yonkers, it might take 6 months to get an appointment. Yeah. By the time you get that appointment, that person might not be around any longer, which was the case of the man that jumped from 220 Yonkers Avenue. Mother had an appointment, but the person jumped before they reached to that appointment. We need to do things that will bring solutions. We can talk about the problem, but we need solutions. We know what the problem is, but we need solutions. At the county level, what are you doing? Yeah. You and the people around you.
And that's a good point, and I think we all would agree, it's probably the biggest public health crisis in our country, mental health. And when you look at cancer rates, when you look at other health-related rates, fatality is going down. But interestingly and sadly, suicide rates are going up in this country, overdose rates are going up. So it clearly is a public health issue, and in Westchester County we struggle with some of the same issues. Now, just like we all have physical health issues, we all have mental health, right? We're all on the spectrum at some point. So what is the investments? We don't have insurance. We have insurance parity in this country, but it actually doesn't trickle down to hospitals and clinics. So we're fortunate to live in a county of Westchester where there are and there have been significant investments, thanks to Legislator Nolan and many other folks in Westchester who have invested money in prevention, and I can talk about a little bit about school mental health clinics we have now throughout Westchester County. We have youth mental health first aid training, and we've also had new services such as our mobile prevention crisis response teams. Our county, thanks to the leadership of many, have now invested funds to co-locate mental health teams within our police departments all over Westchester County. So in reality, there's a co-response. So if someone calls 911 or 988, which is our suicide prevention hotline, police will respond. They have the ability to dispatch mobile crisis workers with them on the scene to assess for mental health risk and to not only make sure they get into the appropriate service like a hospital, but to follow them post-discharge as well, so they're not returning to the same situation. This is unprecedented in New York State that we have this level of services. Do we have to invest more as a country, as a state, as a county? Absolutely.
When that call, go ahead.
Sorry, just for an example, it was about a couple of weeks ago, I reached out to you, I saw somebody that was writing very disturbing stuff online. They were obviously looking for help, and I, contacted the commissioner, he sent me the information, and I forwarded it to that person. So it is accessible, it's there. We do gotta make sure, especially elected officials, that we advertise them more. We gotta make sure that we put every resource out there. Like, I started talking about possibly putting this on buses. This type of information is crucial because it's a real issue. It's a real problem. And I think, actually, and you probably know more, the issue is actually shown more and grown more since the pandemic. People being trapped inside for so long, it really showed how crucial mental illness could be and how resources are necessary. It's definitely something that nobody should be embarrassed about either. Even if you don't think you have, just think about it, or if you have a loved one, a friend, a family member, or a coworker, contact somebody for them. It's important.
Now, the thing that you just spoke about with the police department, that you have a team that are ready to go with the police department, how does that get triggered? 911 receives the call. I have a family member that suffers from mental illness, has a history of it, and the person is doing this and that. Does the police goes there immediately with the other team, or do they go make an assessment and then call you? How does that work?
That's a good question. There's two major access points. Some people would prefer not to involve the police department appropriately. They may not want them involved. So you can call 988, any resident in Westchester County, that's St. Vincent's Hospital, and they will speak to a person, they will speak to a family member, and they also have the ability to dispatch a team to go on site. They also have the ability to dispatch the mobile crisis teams that are embedded in the police department. So if someone calls 911 and is seeking help, they're not sure if it's a mental health problem, what have you, the police dispatcher will assess the situation. Obviously, you always want to secure safety for everyone, but they may go out with the mobile crisis team, or they may first secure safety and then have the mobile crisis team back them up to address the situation. So we want to make sure that everyone is safe on the scene, but if it's primarily a mental health issue and needs that attention, they will be there to take the lead in those situations.
If I want to call for help, but I don't want to call the police. I want to call their department first.
Yep.
Do you have the number by memory that we can share with the people that are watching, or you want to give it to me later? And I'll
Sure.
post it?
988 is the new National Suicide Prevention Hotline. It used to be this number that no one would remember. So the federal government got smart, 988. So any 914 call will go to our St. Vincent's team. They will get a live mental health person who will speak to the person, the family member, and decide what's the best course of action.
So guys, you hear, if you are in a crisis, you feel like your loved one, your friend, is reaching that point of no return, take the initiative. Call. He might be upset at you at the moment. The reaction might not be the one that we want, but potentially you save his or her life.
Absolutely.
But Do we have enough programs to address the issue? We go to the hospital, we send somebody to the hospital. The person goes 45 minutes later, he's back home because insurance doesn't cover. Who's responsible for that bill? Do we have programs that will address the issue right away?
And you hit it
Cut
right,
the bureaucracy.
You hit it right on the spot. How do you pay when you break your arm, when you have a fever, you go to the hospital? What pays for the service? Insurance. Mental health, behavioral health does not have the same rates, does not have the same support as physical health. So that should be the #1 fight in this country, is making sure our insurance companies pay for mental health services. So if you need to stay in the hospital extra few days, if you need outpatient services, that the resources are there to support our mental health needs. We're fortunate in this county that we have invested services beyond insurance to support some of these mental health programs. But as the legislator said, especially post-pandemic, we've seen an increased need. People who never had mental health issues are struggling with anxiety, with co-occurring disorder, where they may be drinking, leading to depression. So we need more services, and that means having qualified people who get paid a rate that is a rate that they want to go into the field of social services and behavioral health, and that all starts with insurance parity.
Do we, or not we, you, do you take any kind of pro-action in order to determine who needs treatment or not? Give you a short example. Right down the block, less than a block down, there was a man that slashed a woman's neck. He was apprehended. He was incarcerated. Not long after, he was released. I was told the person suffered from a mental illness. 6 months later, give or take, he killed somebody on Vineyard. Do you have a team that goes around talking to the homeless? Because many of the issues with the homeless, mental illness.
That's a good point. One of the things that's changed over the course of years is we no longer expect people to come to an office for services. Our resources, whether it's provided by the county or our agencies, are out in communities. So we have what's called street homeless workers who are out on the pavement, talking to people, trying to engage them and being very person-centered, making sure, what are your needs? Is it housing? Is it food? Is it mental health? We have now therapists who are embedded in school districts. So they actually have a clinic in the schools. Mental illness, most of it, 50% of mental illness is detected by the age of 14. So think about if we got a hold and we're able to engage those young people before they get older to address mental health. And by age 21, 75% of people already have onset of mental illness. So a lot of the work should be prevention as well. But to also talk further, we have homeless outreach. We have a program within the county jail that provides mental health services, substance use services, also for opiate treatment, to initiate treatment, so when they're discharged, they don't have to start right away, that they already have services and then being referred to an outpatient clinic.
Go ahead.
I'm actually happy that you mentioned the county facility, because recently, I think a couple months ago, we opened up that new office that we have for any first responder or county employee to come to, and you're going through things and want to speak to somebody, we offer that now here for employees of Westchester County and for first responders. It could be fire, cop, correctional officer, nurse, anybody. It's important to make sure that, that's not in the public, but also in your work life as well, that you have an outlet to go to vent to with certain things. Because, most importantly, not most importantly, but, first responders, they're exposed to a lot of things. They should be able to vent, they should be able to seek help without being criticized, that they can't handle it. They need an outlet as well. So I'm happy that we were there for the opening of the office too.
Police response to a call. They come in, they speak with the person, take them to the hospital. Police doesn't stay around to determine what the diagnostics is. They don't know if it's mental. That's for the doctors. Once that is determined, it's mental illness. Is the police who calls your department, or is the hospital that calls your department for the follow?
Yeah, that's a good point. There's a couple of things. First, when someone's assessing, hospital is not always the appropriate response. Obviously, if it's a matter of safety, we should be going to a psychiatric hospital. We have other services in this county. We just opened an intensive crisis mental health program, thanks to St. Vincent's, where people can go who have mental health issues but don't need a hospital, or they just can't go home. So we're creating a crisis stabilization in this county where people can go up to 23 hours who really don't need hospital level of stay. But your question, if a person is admitted in a psychiatric hospital emergency room, they're required, the hospital, whoever is working there by law, to facilitate discharge planning. And that means making an outpatient referral. It means calling for case management services. There is an expected, and by regulations, have to refer that person to services. So it's not the police department's responsibility, it is the mental health providers, and if they're connected to our mobile crisis team, they will take that initiative. We've already seen some amazing results where police will tell you they no longer have to sit in the emergency room, that they know that the mobile crisis team is going to follow that person. So this program has been fully operational for about 2 years now, serving thousands of people throughout Westchester County to make sure that they're getting the right services.
So maybe you have an answer for me, and when I say for me, I mean for those that are watching. Because this interview, I'm asking questions that I think the people who are watching us wants to know the answers. Civil rights laws. Police comes, talks to somebody, the person refuses treatment, I'm okay, I don't want to go. And police say, well, look, if the person does not want to go, it does not want treatment, we cannot force him. But if that person has a mental problem, maybe the person does not accept the problem that he has. So does that person has the right to refuse treatment, or should police take him anyway if they suspect that the person needs treatment?
Yeah, and obviously a person's rights is critical. We take that very cautiously. Under New York State mental hygiene law, if any person is at imminent risk to self-harm or hurt others, there is a designation for police officers, myself as commissioners, or other mental health people to order an evaluation at a hospital, a psychiatric hospital. So there are many first responders, myself included, police, that have the ability to order that person because they're deemed at risk due to their mental health condition for an evaluation. When they then get the evaluation, it's really determined by the doctor what level of need, whether they do need hospitalization or they no longer need hospitalization. So under mental hygiene law, that is something in New York State that we have to support people and protect others as well.
Well, I'll tell you about the passage that somebody called me up. They had somebody who lived or lives on North Broadway on the 10th or 12th floor, I don't remember, that was putting a plywood board off his porch in the rear of the building, lay down for sunbathing. They called the police reacted, police went there, they did what they were supposed to do. They removed the man, they took him to the hospital. 45 minutes to an hour later, that person was back home because the person supposedly didn't pose any risk to him or to others. Well, if he's up there and he falls down and my son is driving with his bike down on the street, he poses a risk to me. I called the police department, they said, Rue, all we can do is go there, do what we have to do, but him stay in the hospital for treatment or observation, it's up to the hospital.
I mean, obviously, I don't know the details.
I don't know the details either.
I would hope that if a person's not deemed at risk for being in a psychiatric hospital, that we could provide extra outreach engagement services. I don't know what was offered to this individual. We have also what's called assisted outpatient treatment in New York State. It was originated through Kendra's law when there was a person with mental illness who pushed someone who died off the train platform. So assisted outpatient treatment, if a family member or a therapist feels someone is at imminent risk and unable to follow through with treatment, there is a court order through our department that we can have a court order that follows that person to make sure that they're meeting all their criteria, whether it's treatment, medication, and if they fail to comply, we can go back to court. It's not meant to be punitive, it's to help that person and to help the community. Currently in New York State, they're looking to expand assisted outpatient treatment so we can reach more people who aren't able to make good decisions because of their mental health conditions. So that's something to look at. It's called assisted outpatient treatment.
Is there any programs that would help families expediting a appointments. Sometimes 6 months, it's a very long time. I cannot wait 6 months.
Yeah.
And mental illness can be treated at any second. Any second, things could turn out for the worst. If there is any way or any mechanisms that will help the family expedite that appointment that you know of.
Well, a couple of things. First of all, if they're being discharged from a hospital or from corrections, that is a priority referral, and they should have easier access to engage in outpatient services. And you can call our department to help to facilitate or at least remind people what the regulations are. We also have different programs like ACT teams, assertive community treatment, where the therapist and the doctor actually go out in the community for people who need that level of care rather than expecting them to come to the community. So my suggestion is to call our department to find out, family members can call, what services are out there. If you feel that your loved one is still at risk, call our department, 914-995-5220, and we can help the family kind of look at what services they may be entitled to.
And expediting appointments as well?
We will do our best. If
Whatever
we can.
the possible.
We will do our best. And we would love to expand outpatient services. Over the past 4 years, we used to only have 40 school-based satellite clinics in this county, and Yonkers schools have been wonderful. We're up to 76 school-based satellite clinics, so we've expanded services. Our department, thanks to the legislator and our county executive, we're opening a county clinic again this year in White Plains to expand. One to start with. Two, and so we're looking to expand. All of our agencies, it's not like they don't want to expand. It's all about payment and rates. Insurance has to pay what they pay for other medical issues. If they pay at the same rate, we could expand more services throughout Westchester County and New York State. So the parity issue is critical.
Maybe you should work with our legislators to change the laws that will force the insurance companies to treat mental illness as they do the diseases.
At federal level, the law exists, but it's not being implemented. Our Congress looked at, I think it was about 90 insurance companies. Not a single, I think it was 98% were not in compliance with the national parity laws when it came to behavioral health. So although it's on the books, it was 95 or 96 did not even come close to meeting federal parity when it comes to behavioral health. This is a federal issue.
You see, the problem is sometimes it's not laws, but compliance.
Exactly.
It's compliance. Because we have laws for almost everything.
Exactly.
But the compliance is a whole different thing.
Yeah.
But I can guarantee you that if tomorrow we have a get-together in the park across from us,
I don't know about tomorrow, it's be cold.
don't matter, because to take pictures they show up all the time. And we call a whole bunch of politicians for a picture opportunity to talk about mental illness. They all show up for the picture, regardless if it's snowing, raining, thundering, don't matter. But at this point, families, those that are watching us, they want much more than pictures. They want actions. They want solutions. They want treatments. They want to cut bureaucracy. They don't want to wait 6 months for treatment. I don't want to wait forever. And lots of families are also available of branding because they're afraid that once they go to a doctor and they are branded, that they suffer for some type of mental illness, it's going to have an impact on them professionally. How do we address
Well, I think we've come a long way, to be honest with you.
But not all the way.
I've been with the county government for 30 years. I've been in this industry for 35 years. I think it's important that mental health is a responsibility of all of us. We're doing a faith-based initiative now where we're working with our clergy, regardless of what denomination, Catholic, Christian, Jewish, Muslim, Buddhist. We have a Chamois monk who now go into their places of worship and are talking about mental health, talking about mental illness. Many of the worshipers are coming to them for support. So we meet monthly with our faith-based community to train them, but also have the conversations, normalize this discussion. We're doing the same in schools now. As the legislator said, we're doing it now with our first responders. We have also a veteran suicide prevention task force where we're trying to normalize this and have people talk about it so they can better support their loved one, but also educate all of us, our legislators, our elected officials, really about mental health and mental wellness. And that's really what we're talking about today. It's all of our responsibility.
I'm at home with my son and my daughter, and I noticed that something is not right.
Yep.
At what point should I act? Immediately, So sometimes, oh, let me wait. Let me see if this is a phase, if it will go away. Sometimes that waiting.
Well, my first question to you is how comfortable are you talking about feelings, mental health, mental illness? Are you going to make it comfortable for him or her to share? If they say something, are you going to be scared and say, I don't want to go there? Or what's your comfort level? And then maybe speak to a pediatrician, maybe speak to the teacher, and then obviously see what help is out there. But it starts with us all knowing the vocabulary, the language, even open up the conversation. Many people aren't. Many people are not.
That's where I wanted to get at. How do we make that determination? How do we set up the roots for us to have that conversation with our kids? Opening, channels of communication. What suggestion do you
Well,
have?
first we got to get off the smartphones ourselves, right? When we speak to our families, not now, but in general.
Yeah, I'm working.
And we have to be alert, we have to be aware, we have to be prepared. There's something that we've promoted in this county, but all over the country. It's called mental health first aid. It's basically the CPR of mental health. And if you took CPR, if you use it once in your lifetime, that's good. Mental health first aid, we use it every day with our colleagues, with our spouses, with our kids. How are you feeling? If they say something that's alerting, you know how to respond. So we've embedded this training in all the schools with our first responders. We're doing it now with businesses. We're doing it with lawyers and judges. So it's learning the vocabulary of how to help someone who may be in need. Not that you're the therapist, but you are comfortable addressing it and then getting the right help.
So it's important for parents and guardians to have an open channel of communication with those around you. Not necessarily your kids, but your wife, your brother, your sister, but have a certain level of comfort to speak with them and then address the issue in whatever way it's best to be addressed.
You know why that's important? The first time a person experiences a mental health symptom till the time they get help, 12 years. That's the average.
Wow.
So could you imagine if we had those early conversations, maybe a couple of months or weeks, that we get that person help? We wouldn't have these situations where people are leaning from the balcony. Obviously, some people are born with serious mental illness, and that's another matter. But we can also avoid a lot of it by just being more preventative and having these conversations and getting help earlier on.
I'm a strong believer of be proactive instead of reactive. Being proactive, you can avoid so many problems. Anything, sir, that I forgot to ask that perhaps you want to mention, that maybe something that I didn't remember? You too, James?
Yeah, I just think it's important. Remember that 988 number. It's out there. Please use it. We get over 3,000 calls annually from our residents. Even if you have a question about services, if you're just not concerned, you don't want help, but you just want some answers and just to have a discussion, please use that number. That can be a lifeline. And again, everyone's mental health is important. So you call the county if we can be of help. Call your school district. Schools have been very active in mental health. But there's help out there and you deserve it. Don't wait is really the final word I have.
Once again, what is your department's phone number?
Sure, it's Department of Community Mental Health, 914-995-5220.
And guys, don't forget that number, 988. It's an important number. Put it on your refrigerator, share it with your friends. If you see a friend, family member that is in crisis, don't be afraid to call. It's better to call and they determine that it was not necessary than you not calling and find out tomorrow that you should have called.
I agree. This is an urgent matter today. I know the commissioner, like I said, he spearheads, he does a great job. That's why I brought him today, because I can only say so much, but he's the one leading the charge here in Westchester County and like I said, New York State. But it is a concern, and this is something that we all need to face together. No matter what your status is or who you are, you could be the richest man in the world or the poorest man, or whatever the case may be. But if you need help, there are resources, and you should certainly reach out and just talk. And also, if you know of anybody that says, "Are you okay?
Yep.
Good enough.
Do you need anything?" And that matters.
I just got a question. It says, if you encounter a stranger having a mental episode breakdown on the street, I assume, should you try to assist by talking with them or call 988?
Yeah, I think it's up to the person, but if you feel any risk to yourself or others, I would call somebody. I would call the police, call 988, and they could assist you with that situation. We don't want to put anybody at risk. If you feel unsafe, I think you should call.
Because sometimes we have good intentions, but
Absolutely.
we're not equipped
Exactly.
to deal with the situation.
If it's your colleague, if it's a friend, and you feel comfortable, absolutely engage them.
On that note, we conclude our interview. Thank you, sir. Thank you, legislator.
Thank you.
I appreciate you responding immediately
No problem.
about this when I called you. And I thank you, sir, for taking the time to come and sit with us and give information to those that are watching. Yonkers Voice is not my voice. Yonkers Voice is the platform where you can connect with those that can help us and those that are in charge of representing us to resolve or finding results for the situations that we might be faced. Thank you, and until next time.